I would like to see a comparison of the levels of protection against infection, illness, hospitalisation and death between those that are vaccinated and those that are not vaccinated but have had natural infection. Because natural infection, I contend, is our long-term way out of this pandemic as we move to endemicity. Pfizer and BioNTech initiate rolling submission for emergency use authorisation for their COVID-19 vaccine in children 6 months to 4 years. And here we have the this is basically, I think this is basically a press release now. Anyway, the states generally dropping mask requirements for businesses. So the Republican states have kind of been down on mask wearing for quite a bit. Now the Democratic states are joining in. I'm looking forward to seeing the risk-benefit analysis because, you know, to me, these medical interventions are really all about the risk-benefit analysis for the individual. Now, yes, if we immunise millions of children, that's going to increase herd immunity. I think that's fairly clear. But what's the risk-benefit analysis for the individual child? Because healthcare, to me, while we do want to give blanket advice on some things, it's about the individual. So will the individual child be better off is the question I would want answered in my own mind first. So let's look at all. These are aged to 11. Now, of course, in the UK, we are not vaccinating anyone before their 12th birthday. So this all represents natural infection. So 8 to 11-year-old, I think this is an important figure. This is natural infection causing natural immunity and the natural development of antibodies. And that 71.2% is probably the lower estimate for those that are enjoying immunity, because some children will have been infected before, developed memory B and T cell responses, but the antibodies could have fallen below the below the level that the Office for National Statistics is testing for. And then if we look at this one here, 12 to 15, this is the total number here, 91.9%. These are the ones model children who reported vaccine. So this is after 1 dose of vaccine, 2 doses of vaccine, because less children have had 2 doses of vaccine, of course, but this is the total amount of immunity. And we see it's somewhat bolstered by the vaccine. So children 8 to 11, 71% without vaccination. With vaccination and natural immunity in children aged 12 to 15, 91.9%. So again, I would like to see more emphasis on natural immunity. Now, this is excess deaths. Now, I'm not going to go into this in detail, but we clearly see the excess deaths unambiguous in the previous waves and the tragedies that are associated with that. But if we look at the current situation, we see all deaths here, COVID deaths here. Now, the important thing here is that these black lines here are the 5-year average. So we notice that deaths at the moment are quite a bit below the 5-year average, which of course is good. So deaths are currently, deaths are overall below the 5-year average. Now, this is hospital admissions involving COVID-19. Continues to decrease but remains similar. Okay, so we are seeing a downward trend in hospitalisations. Now, we see infections are most common in the younger age groups, age 2 to school year 6. Okay, so this is basically 2 to 11-year-olds, isn't it? And we see that the infection in those have increased. And we know that very few of them are becoming ill. And again, this means that a lot of children in this age group will be acquiring natural immunity because they're not vaccinated. Of course, hospitalisations way more common in the 85s and over, going down fairly dramatically with age group on the whole. But we do see a slight increase in the 0 to 4, which is concerning. But we believe that most of these children aren't very ill in the majority of cases. There's always the exception, especially in children with comorbidities. 85 and over, most deaths, and then deaths go down with decreasing age. And in the younger age groups, thankfully, On this graphic, no deaths are registering at all. So that's again, here we see the order, and the people dying without comorbidities are much smaller. It was about 17% maybe, because this is percentages, something like that. So if we add up all these together, the vast majority of people had significant comorbidities at the point of death. So what we see is there's 9% of people nearly in the UK over the age of 12 who have had no vaccines at all. Completely unvaccinated. Now, this represents a large group of people. This is the data we've looked at a few times now from the CDC. And I haven't seen any updated data on this from the CDC, but this is laboratory confirmed cases. And up here is greater risk. Down here is lower risk. So you want to be as near the bottom of this graph as you can, basically. So clearly people that are unvaccinated, much bigger risk of infection. People that have vaccinated but no previous infection, they're down here. People that have been vaccinated and have had previous infection, and people that are unvaccinated without previous infection are down here. So these people down here with this very low risk have had no doses of vaccine at all. They're just protected by natural immunity because they have had the infection, but they have not been vaccinated. And we see they actually do better than people who have not had the infection but have been vaccinated. I mean, to me, this is really shouting loudly and clearly the importance of natural immunity. And I'd like to see more data on this. So that's the risk of, that first one, where was that first one? Was it New York or California? That was New York. The next one's California. Risk of hospitalisations, and again, way greater risk, way up here, much greater risk. Of course, the cases rise and fall with the number of cases in the community with the pandemic as it flows or evolves, whatever you want to say. And again, down here we see the level of protection against hospitalisation with people that have been vaccinated. Now, if people haven't had the infection, look at the huge difference there. People that are unvaccinated and people that are vaccinated, much protected. But then we see people vaccinated with no previous COVID-19 diagnosis. And down here we see unvaccinated previous COVID-19 diagnosis. So that's this blue line right down here. So remember, these people are unvaccinated but have had the natural infection. And we see they're enjoying remarkably high levels of protection. Basically the same as people that have been vaccinated for most of that line, just because they're enjoying natural immunity. So percentage testing positive for COVID-19 in England is actually probably going up slightly, indicating ongoing community transmission. Likewise for Scotland, if we join the dots, we see similar figures, went up, went down, but now it's going back up again. And this is, so we're getting these ongoing infections, but we are getting, as we saw, reducing hospitalisations. So with the ongoing infections, of course, we're getting more natural herd immunity. So what I'd really like to see is the unvaccinated group in the UK being used as a comparator group, as that data did from New York and California, and made clear so that even I can understand it from the graphics. At least 2/3 of 8 to 11-year-olds have COVID antibodies. Now, of course, 8 to 11-year-olds in the UK are not vaccinated, but as we've noticed, they're saying at least 2/3 of those have antibodies already. And from the data we've seen, natural infection without vaccination is producing excellent levels of protection. So I'm unclear why you would want to vaccinate people that have already had the infection. So what we need to do is if people have had the infection, I think we need to individually assess them to decide if it's in their benefits to have the vaccine or not, rather than this one-size-fits-all approach. So that's what I'd like to say, a much more individualised, bespoke, personalised medicine approach. Because that is saying that at least 2/3 of 8 to 11-year-olds have got COVID antibodies, therefore have had the virus. Therefore, if they've had the virus, they should have the T cells. They should have the B cells to provide the hopefully much longer lived protection. That was data up to the 17th of January. And remember, 8 to 11-year-olds in the UK not vaccinated at all. Now, it's different from the States. In the UK, the youngest people that are being vaccinated are people who are on their 12th birthday. Different to the States. So remember, this has all got to be natural exposure that's led to this, what I would say is a desirable situation, because they now have immunity. 8 to 11-year-olds between 63 and 72% would have tested positive for antibodies. So again, that's their figure. 12 to 15-year-olds, it was higher, as we noticed on the graphic. COVID-19 deaths in England and Wales drop, which is good news. So deaths are down somewhat. So of 12,401 deaths, England and Wales, 1,385 were virus related. Mentioned the virus, and as we saw, we can assume, what was the figure on that graphic? Was it about roughly 85% of those are directly attributable to COVID? So many of these people would be with us, and yet we also notice from the graphic that the 5-year overall mortality is down significantly. Long COVID, more than half a million with long COVID for at least a year. Wow. 500,000 people in the country with long COVID for at least a year. 6th of December to the 2nd of January, 2.1% of the UK population, 1.3 million people said they were living with long COVID. Of those, 42% they'd had it for at least a year. Fatigue being the main feature. So 500,000 people with long COVID for more than a year. How is this going to plan out? Are they going to get dramatically better soon, we hope? Or is this going to go on for a longer period of time? We simply don't know, because the time has not elapsed yet. Something to think about. It'd be nice to have more comparative data, because we do have this ready-made large experimental set of nearly 9% of the population over the age of 12 who've not been vaccinated at all. So a really good comparator group that we could take advantage of.